Question number 1. A patient with Addison's disease is experiencing nausea, vomiting, and confusion. What is the nurse's priority action? The right answer is option B. Check blood glucose and potassium. Question number 2. A patient post thyroidectomy complains of tingling around the mouth. What is the nurse's next step? The right answer is option A. Check serum calcium. Question number 3. Which finding indicates a complication of peritoneal dialysis? The right answer is option C. Cloudy effluent. Question number 4. A patient taking clozapine develops a sore throat and fever. What is the nurse's first action? The right answer is option D. Check WBC count. Question number 5. A mother in labor is receiving oxytocin. The FHR shows late deceleration. What is the nurse's priority? The right answer is option B. Turn the client on her left side. Question number 6. Which action is appropriate when a patient with TB is being discharged? The right answer is option C. Continue medication for the at least 6 months. Question number 7. A trauma patient shows signs of increased ICP. Which sign is most alarming? The right answer is option C. Waning pulse pressure. Question number 8. A nurse suspects abuse in pediatric patient. What is the best action? The right answer is option C. Report to authorities per protocol. Question number 9. A nurse notices medication error made by another nurse. What should be done first? The right answer is option B. Report to supervisor. Question number 10. A patient receiving gentamicin IV reports tinnitus. What is the best action? The right answer is option B. Hold medication and notify provider. Question number 11. Which electrolyte imbalance is associated with digoxin toxicity? The right answer is option B. Hypokalemia. Question number 12. A child with epiglottis present with rolling and stridor. What is the priority? The right answer is option C. Prepare for intubation. Question number 13. A client with COPD has oxygen saturation of 88%. What is the nurse's action? The right answer is option B. Maintain current 0 to therapy. Question number 14. Which is a correct intervention for a client on lithium? The right answer is option C. Monitor sodium and hydration status. Question number 15. A nurse assists a pregnant woman with painless vaginal bleeding at 32 weeks suspected condition. The right answer is option C. Placenta previa. Question number 16. Which finding is most concerning in a patient with a chest tube? The right answer is option C. Continuous babbling in water seal. Question number 17. Best nursing action before administering blood transfusion. The right answer is option C. Verify patient ID with two nurses. Question number 18. A diabetic patient becomes sweaty and confused. What is the priority? The right answer is option C. Give 15 g of carbohydrates. Question number 19. A child with nephrotic syndrome is at risk for. The right answer is option B. Infection. Question number 20. Which ECG finding is most associated with hyperkalemia? The right answer is option A. Peak T waves. Question number 21. A client is receiving heparin, which lab value should be monitored? The right answer is option C. APTT. Question number 22. Priority action for a psychotic client with common hallucination. The right answer is option B. Ask what the voices are saying. Question number 23. The most reliable sign of wound infection is? The right answer is option C. Purulent drainage. Question number 24. What is the primary concern after a cardiac catheterization with femoral artery? The right answer is option C. Bleeding at insertion site. Question number 25. Which client should the nurse see first after change of shift? The right answer is option C. Diabetic with blood glucose 68 mg per dl. Question number 26. A nurse receives an order for vancomycin IV. What is a priority assessment? The right answer is option D. Drop level. Question number 27. Which newborn finding requires immediate attention? The right answer is option C. Nasal flaring. Question number 28. A patient with Willen-Behr syndrome is most at risk for? The right answer is option B. Respiratory failure. Question number 29. A nurse is preparing to give a rectal suppository. Which position is correct? The right answer is option C. Left lateral SEMS. Question number 30. What is the earliest sign of malignant hyperthermia? The right answer is option B. Muscle rigidity. Question number 32. What is the nurse's priority for a suicidal client? The right answer is option A. Assess plan and intent. Question number 33. A nurse is teaching about ionized INH. What food should be avoided? The right answer is option C. Cheese. Question number 34. Which is the best method to verify NG tube placement? The right answer is option C. X-ray. Question number 35. What symptom is common in left-sided heart failure? The right answer is option C. Crackles in lungs. Question number 36. What left confirms myocardial infarction? The right answer is option A. Troponin. Question number 38. What is the best prevention for ventilator associated pneumonia VAP? The right answer is option C. Oral care with chlorhexidine. Question number 39. A nurse is an elderly client suddenly confused first action. The right answer is option C. Assess for infection or hypoxia. Question number 40. Which intervention is appropriate for a neutropenic patient? The right answer is option B. No fresh fruits or flowers. Thanks for watching.